So good morning. My name is Yonas Geda. I am a neuropsychiatrist at Mayo Clinic in Scottsdale, Arizona. This morning I would like to talk to you about our research work that will be published by Mayo Clinic Proceedings in May of 2012. In our research, we examined the interaction between computer use and moderate physical exercise. We wanted to see the impact of using the two on the outcome of cognitive function or mild cognitive impairment. The reason why we picked this is that we all know that computer use is very common. Everybody uses computer, and the US Census puts it very high usage. We also observed in previous studies that computer use is associated with a decreased odds of having mild cognitive impairment. In another separate study, we have also observed that physical exercise, particularly moderate physical exercise, is also associated with decreased odds of having mild cognitive impairment. Therefore, we said, how about a combo? One of my research students, Taryn Silber, she said, how about the combo, the combination of computer use and physical exercise? And that's what we did. We looked at interaction. Indeed, we observed that engaging in computer use and also engaging in moderate physical exercise at the same time is associated with decreased odds of having mild cognitive impairment. We have control for age, education, caloric intake. Therefore, this finding cannot be explained by caloric intake, age, sex, and education. The key is perhaps a person will be using computer, in the morning, and then might be exercising in the afternoon. So it's really, I want to remind you that one of the major research works that came from Mayo Clinic, it happened to be from Mayo Clinic, Dr. Jim Levin has shown there is what he calls NEAT, non-exercise activity thermogenesis. In that study, from his conclusion is that if a person can use a little bit of treadmill, maybe it could be at 1 mile per hour, or at the same time use computer, perhaps it might even be beneficial, but we haven't looked at that. Well, the next step, of course, is this is case control study. We need to confirm that in a future cohort study. So until then, we consider this as a preliminary, and hopefully at some point in the future, people will be able to use interventional research to see such an outcome. So this is the first step is really to confirm findings before we get too excited about this. Based on our study, engaging in moderate physical exercise and engaging in mentally stimulating activities at the same time seems to be beneficial to our brain, particularly to our cognitive function. It seems to be associated with a decreased odds of having mild cognitive impairment, MCI. MCI is the intermediate stage between normal aging and dementia. Therefore, really, the combo seems to be beneficial, and that's the take-home message.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.